Hi, my name is HWillis and this is my patient perspective presentation. As healthcare professionals, we need to provide culturally competent care and need to remember that all patients need equal treatment no matter their age, race, gender, or disability. The next three slides highlight the patient's story. First, I would like to give a brief explanation of the facility. The facility is a forensic psychiatric state hospital that houses patients diagnosed with a mental illness that committed a crime. Patients are sent here from jails, prisons, and or other state psychiatric facilities to get mental health treatment. This patient is a 48-year-old African American male. He was diagnosed with major depressive disorder with psychotic features. He was on the admission unit, so he was just about a month or so in the hospital. He was transferred here from prison as he was voicing suicidal ideation in prison, and they felt he needed to learn coping measures and have his depression stabilized on medications. This particular day, he went to his treatment group but returned early to the unit. He voiced experienced suicidal thoughts. In the past, a low dose of Remeron, an antidepressant, helped him cope. The nurses notified the psychiatrist while watching the patient on a nursing judgment 1-to-1 for DTS, danger to self, which is a self-harm prevention strategy and policy in this hospital. The psychiatrist interviewed the patient, at which time the patient asked for the medication. According to the patient, the psychiatrist told him, "Last I looked in your chart, I did not notice that you had a medical degree." The patient was placed in room seclusion. Room seclusion is a locked room with a mattress on the floor, a urinal and a water carafe is also provided, and a staff member sitting outside the locked door. The nurses advocating for the patient informed the psychiatrist that patients that are suicidal are not allowed in room seclusion according to hospital policy, as they can hurt themselves while in there. The psychiatrist refused to acknowledge the nurse's request, and the nurses felt helpless. They paged me, the health services specialist of the program. At that time, I was a health service specialist, which is a clinical supervisor and assures proper clinical treatment of patients in the hospital by staff. I notify staff to tell the psychiatrist that the patient that is suicidal cannot be in room seclusion and he needs to be released. Upon my arrival, the patient was out of room seclusion but in restraint in a chair in the quiet room. I first talked to the patient. He was very upset. He reported that he did not have a plan. He told the doctor that. He just asked for help by asking for an antidepressant to cope with his suicidal ideation, and he was placed in restraints. After talking to the patient and staff, I talked to the psychiatrist. The psychiatrist refused to listen and kept telling me he was the doctor. It was explained to the psychiatrist that a patient that doesn't have a plan to commit suicide can be sufficiently watched on a 1-to-1 observation to prevent self-harm. Especially when we had another patient that had a plan, had multiple suicide attempts, and he was on a 1-to-1 observation. When he was asked why the patient was in restraint, the psychiatrist stated, "Because he's not telling me what I want to hear." So the patient is getting punished because the psychiatrist's needs are not being met by the patient not telling him what he wants to hear. The psychiatrist's behavior was reported to his supervisor. He was eventually let go from the hospital due to no changes in the psychiatrist's behavior towards patients and staff. The domain from no MedCert that are relevant to this patient perspective are respect for patient preferences and shared decision making, patient-provider communication, and experiences leading to trust or distrust. Delivering culturally competent care is not a choice, but rather a necessity, especially in psychiatry. Mental health professionals need to be sensitive to patients' needs, disability, and build trust to allow for the best healthcare outcomes. Respect for patient preferences and shared decision making. Patients who are active participants in their care have improved healthcare outcomes. By informing patients, inviting them to discuss treatment options, and partake in decisions, one would respect autonomy, achieve more tailored decisions that would lead to better patient health outcomes. Instead, the psychiatrist was rude, dismissed the patient concern, as well as preferences of the use of an antidepressant that the patient knows worked in the past. The psychiatrist did not invite the patient in a discussion about treatment option or shared decision making. Patient-provider communication. Communication during any care, whether medical or psychiatric care, plays a vital role in decisions about subsequent intervention and can influence patient adherence, satisfaction with care, and health outcomes. No Metzger article shows that less health information reaches minority groups patient, and patients with low education and socioeconomic status get far less health information. The psychiatrist needed to be more sensitive and compassionate to the needs of the patient. If the psychiatrist did not agree with the patient about giving him Remeron, appropriate communication such as explaining to the patient why he was not willing to prescribe that, alternative measures he was going to take, and meeting the patient halfway with other preferences the patient has, instead of making sarcastic remarks and ignoring the patient preferences. Experiences leading to trust or distrust. Trust is a fundamental aspect of the patient-provider relationship, affecting every aspect of clinical exchanges and interventions from personal disclosure to adherence to treatment. Lack of trust leads to poor health outcomes. Patients who are part of minority consistently seek treatment less often due to misconception about risks explained by healthcare providers. Mistrust of healthcare system is also an issue of great concern for racial and ethnic minorities in the United States. This mistrust has formed an especially strong theme in the African American discourse. A strong historical context underlies this mistrust, stemming from a long history of abuses, including the infamous Tuskegee syphilis experiments. Placing the patient in restraint perpetuates the distrust already in existence in African American men when his preferences was dismissed. This distrust might lead to poor outcomes for this patient in the future, such as committing suicide due to the experience with asking for help and being placed in restraints instead. How did all parties contribute to this situation? The patient voiced his preference. The psychiatrist disregarded patient preference, made a rude remark, placed the patient in room seclusion and restraints. Nurses unable to advocate successfully for patient's release. The HSS communicated with patient, then with the psychiatrist. After some debate, patient was released from restraint and placed on a one-to-one observation for danger to self. Potential solution. The psychiatrist should have listened to the patient. He was contributing to his treatment with what he knows worked for him. Psychiatrists need to become culturally sensitive to the patient, being a minority, and having mental health diagnosis. Nurses to continue to advocate for patients and following the chain of command to accomplish that goal. Psychiatrist was ultimately let go as he did not change after this incident. The hospital employs the treatment strategies of wellness and recovery, which is patient-centered care. Patients give input in their care, and there is an active dialogue with his team of healthcare professionals that consists of the psychiatrist or psychiatric mental health nurse practitioner, psychologist, social worker, unit supervisor, shift lead, registered nurse, and rehabilitation therapist. As you can see, healthcare professionals need to be open-minded and allow for patients to discuss treatment options and partake in health decisions for a better health outcome. Thank you for listening to my presentation. I hope it was informative. The following are my references.